is up, everybody? Welcome back to the Dr. Greg Jones Optimization Academy. I am honored. It's a pleasure to have Dr. Amber Krogsrud back as a guest. If you don't remember from my first podcast, me and Dr. Amber had a great conversation on peptides. I'm going to take this a little bit further, be a little bit more specific this time, and I'm happy as all get out to have her here today. So for those who were not available for the first podcast or didn't listen, Dr. Amber is a licensed naturopathic doctor at My Bright Wellness and director. Okay, I love having an editor. Dr. Amber is a licensed naturopathic doctor at My Bright Wellness and medical director for KIYA Longevity and resides in Los Angeles, California. She's trained in regenerative medicine, detox protocols, hormone testing and treatment, bioidentical hormone therapy, peptide therapy, and IV nutrient therapy. She is also, I'm killing it today. She also has a practice in Redondo Beach, California, where she specializes in bioidentical hormones and peptide therapy. Dr. Amber is a member of the International Peptide Society, the IPS, and has completed peptide therapy certification training through the American Academy of Anti-Aging, A4M. So welcome back, Dr. Amber.
Thank you. Oh, this is fun. Yeah, we'll talk about some sleep peptides. We were just recently at the Peptide Congress. So it was good to connect with you there.
I know, and in real life.
Yeah.
So I think we had first and second place in the unofficial hair contest out there, and that's okay. We deserved it. We've worked hard on this. So, it's just great to kind of be in that room with a lot of people that have been talking peptides a little bit longer than us. And it's so great when you're hearing things and you're saying, oh man, I was thinking the same thing, or I'm thinking something similar, or this is something I've had a great interest in. So being in a room full of like minds like ourselves was an amazing experience, and looking forward to the next time. So we are going to talk about sleep and sleep peptides, because I know for me, and probably so for yourself, that is one of the main questions or one of the issues that people bring up. They can't sleep. Either they can't fall asleep, they can't stay asleep, or they just don't feel well when they wake up in the morning. So sleep is a very complex issue. So there's so many factors that have to do with getting optimal sleep. So we're going to talk about some of the reasons why people can't sleep. We're going to talk about some of the importance, why is sleep important besides being well rested. And also, when it comes to how do I improve my sleep, we think, there are supplements, there are medications, there are peptides. We'll kind of give a very brief overview in this part one of those. And then part two, we're going to talk more about the specific peptides. So first things first, Dr. Amber, why can't people sleep?
Oh, yeah. Well, I'm sure, most people go through a season of their life where they're having difficulty sleeping. And for me, that was year one of medical school. That was my waking up at 3 a.m. every morning. And I'll talk more about maybe why that's happening and what was happening for me, I think, at the time. But a lot of it can be related to hormones, right? And that's what I do a lot of work with women and some men, but mostly women, looking at what are these hormones and how are they driving our behavior, specifically our sleep. So a couple of the things that really come to mind, the last 2 weeks I was wearing a blood glucose monitor, and that's just tracking your blood glucose levels. And so what was happening for me in my first year of med school is I was getting these blood sugar dips and these cortisol spikes that were waking me up at about 3 a.m. every morning. And it's a physiological mechanism, right? So your body can't access stored fat for energy, and so it has to spike that cortisol prematurely. We do want cortisol to rise in the morning, so we wake up around 6, 7 a.m. whenever your wake up time is, but it's just happening really early in the morning for me. Couldn't get back to sleep, had to eat, and we know the disruption that causes eating in the middle of the night as well. So cortisol is a big one. That's stress hormone, often related with blood sugar regulation, right? So I see that a lot in women, especially if they're under a lot of stress to begin with. So those two are really pivotal. The other hormones I think about can be higher testosterone levels in men and women. You can see that can cause like sleeplessness and kind of that anxiety feeling, can keep somebody awake. Hyperthyroid, so that thyroid really sets our metabolism. That active thyroid hormone T3 will go into the nucleus and the mitochondria and turn up the dial on metabolic burn rate and energy production. So if we have too much thyroid hormone, we're amped up, we're too energized, we can't sleep, that could be a contributing factor. Especially we can look at those autoimmune markers that might be driving thyroid. So that's another hormone that's really at play. And then I run this test called the Dutch test, which looks at the difference. It looks at the circadian rhythm of cortisol and melatonin, and these are opposite hormones. So we could have high cortisol, which could be keeping us awake, keeping that busy mind, and then melatonin, which is that hormone that we want to produce at night as we're getting sleepy, getting ready to go to bed, dimming the lights. There's really interesting information about blue light and our cells. So those two hormones are really pivotal. We know that melatonin, right, decreases as we age. Really important for our immune function. It has this antioxidant capacity, so it really keeps us young and youthful as well. And then the other big players is we can think about neurotransmitters like glutamate and GABA. Those are also pivotal. So this has happened to probably to everybody when they were a kid, but even as an adult, if you've ever had a big ice cream sundae or dessert before bed and it spikes those glutamate levels, that sugar in the meal, alcohol could have a similar effect, right? Can spike that. And then we have high glutamate, very excitatory to the brain. Low GABA. GABA is that relaxing, calming neurotransmitter. And that can keep our brain, firing and wiring at night as well. So those are a couple of the ones I think about specific to women. Men have progesterone as well, but when women have really low progesterone helps our brain to make GABA, which calms us down and gets our brain to sleep, helps us when we face stressful situations to really stay grounded and balanced. So for a lot of women, we're working on that estrogen, testosterone, progesterone relationship, looking at thyroid, how are all of those playing a role, and then helping their adrenal glands as well if they're under a lot of stress, supporting the function of those adrenal glands. So and blood sugar regulation. So exercise plays a role in that. Those GLUT4 receptors, right, shuttling glucose in, and then those blood sugar balancing meals, lowering the blood glucose so we don't get those spikes. I don't get the cortisol spike at night. So just a ton of things that could be going on. It's not one simple solution, right?
Yeah. And I think what I love about progesterone is it's a very cool hormone is that a lot of times when you take medications or supplements, their metabolites, our body doesn't do anything with it. You break it down and we get rid of it via the kidney, liver, where the pathway is necessary. What's cool about progesterone is metabolites helping produce GABA, which is, I thought that was fascinating. Like, wow, you get a double dip on that, right? So you get the hormone balancing and then you get the sleep on the back end of it. So I thought that was really cool fact about progesterone. And then again, as men, it's not as vital of a hormone to us as well, but I've heard some stories and studies about men using progesterone to help us sleep, but sometimes that sleep can be a little bit too deep if you take too much of it. So there's an issue there. Now, outside of hormones, what do you see in the nutrient deficiency realm for affecting sleep?
Ooh, well, we need those B vitamins, B6, to make serotonin, melatonin. So I think about those as being depletion as well. Tyrosine, that's really involved in that pathway. Thinking about those robust amino acids. So for a lot of my women in LA who come to me that are vegan and they're on this low amino acid diet, essentially we're not getting the building blocks to make these neurotransmitters that help us sleep. And so having adequate sources of protein in the diet. I like to do bone broth for myself, knowing that there's a beautiful amino acid profile in there to make a lot of those neurotransmitters. Those are the big ones. Is there anything that comes to mind for you as far as nutrient depletions?
Magnesium, that's the first thing I think about.
Yes.
Magnesium is very, very calming, but it also depends on what type of magnesium that you're using, because again, I prefer the glycinates when it comes to sleep, because you get into the some of the mag chlorides that can can affect the bowels a little bit. So again, because it is what we call spasmolytic, so it helps relax muscles. So if you overly relax those bowels, that could be a problem, especially if you're trying to sleep. So just depending on what form of magnesium that you're looking for. And again, sometimes with my patients, like I because of that, I'll have them start on the lower end of it and titrate up until bowel tolerance, and then they can kind of back it up. So I see that a little bit. Those are like the big ones. You hit the B vitamins, you hit the B6, magnesium is a big one. So just having a good nutritional profile, just having all this stuff balanced between, because they're necessary for creating the hormones that help us sleep. That's a big one. Now, another thing, kind of leading into that, because thinking of hormones being deficient and even nutrient deficiencies, I think pain is a big one as well.
Yeah.
Pain is huge. So, and again, that's a lot of times if there's an injury, that's very obvious, but like my big kind of that red flag is someone is in pain that's waking them and they don't know why. If there was no injury, there was no trauma to it, it's like, okay, you're in pain, but you didn't hurt yourself. And that kind of always gets me into the hormone nutrient deficiency kind of side of life. So definitely like to hear your thoughts on that.
Yeah, well, I'll tell you what I do for a lot of women with depression, pain. I've taken this myself, is that low dose naltrexone. So working on that opioid pathway, endogenous opioids. And so we know that LDN, or low dose naltrexone, especially I use it in women with autoimmunity, but it can really help in these kind of pain syndromes that are driven by high amounts of pro-inflammatory cytokines, those inflammatory molecules that are being produced that can wake us up in the middle of the night. And so, yeah, things to quench that. We know that when you exercise, you get a natural production of endorphins, but the number of people that regularly make that a practice is, I think, diminished. And so that's always pillar one, right? Getting your exercise, that mood boosting, those chemicals. But for somebody in pain, that's a big ask sometimes. So how can we modulate that without them having to necessarily get pain from certain activities? So yeah, the low dose naltrexone, essentially how it works is it can bind to those receptors in the brain, and it works on an adaptive response. So it will transiently block the receptors that make those natural pain relieving chemicals, and then in the morning our body will upregulate that natural production of endorphins. And so it can help with pain, it can help with mood. And so that's one strategy, specifically for more autoimmunity pain. Obviously, we're looking at, that's one solution. I'm looking at lifestyle, diet, movement, food. What are their environmental or bedtime habits around light and diet before sleeping? How soon are they eating before sleeping? All of those play a role. So
I'm glad you brought that environment piece up as well, because sleep hygiene is huge. I think for me, one of my struggles was the phone. Was putting the phone away, getting the phone in the other room, the whole blue light thing, if you're not familiar with that, affecting sleep. But also, it's very hard for the mind to calm down if you're looking at news articles or Facebook posts or Instagram posts, because now it's almost like an addictive thing. You look at one post, scroll the next, there's a link in this article to the next article, and next an hour has passed and you're staring at the ceiling because your body, because it's absorbing this blue light, thinks it's time to wake up. And so that's a big one. Temperature of the room as well, keeping the room at a good cooler temperatures tend to be better for most people. But here's the deal, it goes back to your hormones, right? If you have a female patient that is estrogen deficient, they ain't gonna be able to sleep because they're getting night sweats all night. So these are things that we have to take into account as well. So temperature, what we eat before bedtime. You mentioned eating crappy food before bed, eating too late, especially if you're eating something that is going to be more on the processed end of thing or the sugary end of things, that's going to affect our sleep. So again, I love that you brought up that it's so multifactorial. It's hard to just pinpoint that one thing. So I like the shotgun approach: temperature, hormones, nutrient deficiency, let's see how you sleep, and then actually being able to track your sleep as well, depending on what tracker that person likes, so if you're getting the right amount of sleep as well. So that being said, I'm going to bring us into, we've kind of been alluding to it. So we have the patient, you have the person who can't sleep, and now they come to us looking for recommendations. And so let's talk a little bit about the advantages and disadvantages of supplements. Let's talk about the advantages and the disadvantages of supplements versus medications, and then we'll kind of briefly introduce peptides at this point.
Yeah, brilliant. The one thing I wanted to just add to everything that you just said, that I learned at the peptide event this last weekend, was about how our skin cells have, the melanocytes can actually sense blue light. And so even if your eyes can't see it, your skin can sense it. So, having a dark room, and how blue light can age our skin faster when we're exposed all day, like we are right now, right? So yeah, the blue light's a huge piece, and we can't always eliminate it, but we can do our best to get rid of that. So the lifestyle pieces, absolutely, that's really first, making sure that we have all of those, and it's not just one thing, it's all of them. 100% agree with that.
Definitely.
Yeah, as far as supplements versus medications, I think what many of the women that come to me, the situation that they're in is they are so desperate for sleep, and they will resort to anything. And oftentimes that is some sort of medication like Ambien to knock them out, to get them to sleep. And we know that these medications, not only are they highly addictive and they do, there's something extra for the liver to have to detox when we already have hormones and environmental stressors to detox, but we also know the damaging effects long term of using something like Ambien or a lot of these sleep medications on neurocognitive decline. There's research on that now, how it can even be a contributor to dementia, memory changes, brain fog, feeling, I don't know if you've ever taken a Benadryl at night or some of these things that really knock you out into sleep. You feel like you're a little bit sleep drunk the next day. Some people get that from too high doses of melatonin as well. But it really compromises the overall health of the system, even though we know sleep is so valuable to our cellular repair, recovery from workouts, our brain function, that lymphatic system that's constantly cleaning out all of the waste products at night out of the brain, right? That lymph drainage. So yes, we need to get sleep, but a lot of these medications that women come to me taking are actually setting them back in other ways, right? And so what are the other options that we can use? And that's really where you and I come in as practitioners, to give them other solutions to this issue, and root cause approach. So looking at hormones, looking at their environment, and then what things can we add in as far as supplements, avoiding a lot of these detrimental medications. We can use peptides. That's more, some of these are maybe more next level, but can be a really good option for people. So I'll tell you a couple things that I frequently recommend, and it really depends on what's happening in their labs, right? So women with low progesterone, typically I'm going to give her some progesterone support, especially during certain parts of her cycle, that luteal or second half of the menstrual cycle, where we can be a little higher in estrogen, a little lower in progesterone, which many women have on labs. We really want the reverse. We want a nice rise in progesterone. So in younger women, I'm giving them more of chaste tree berry or Vitex, really good at boosting that progesterone, evening primrose oil. Sometimes I am doing kind of a low dose progesterone from day 14 through 28, optimizing for that. But as far as actual supplements, after we fix all the hormone things that are going on, it depends on, I don't give, I find that most of my women, there's controversial information about melatonin and how it could potentially shut down other hormone pathways in the body, especially at a super high dose. There are some women who do, I think, feel good on it, but a lot of times the 3 milligram, 5 milligram, 10 milligram can cause that sleep drunk feeling. I don't know, have you ever experienced that yourself with melatonin?
Yeah, I am a horrible experimenter on myself, because sometimes I'm like, oh man, I know there are 3 anabolic hormones. That's gonna be your testosterone, your growth hormone, your melatonin. And as a younger doctor, I'm like, wait, melatonin is anabolic. Give me all the melatonin. And then you take a 10 milligram or a 20 milligram capsule, and you wake up thinking like, who drove a bus through my bedroom, and I can't sleep. So, it's just kind of, and again, it's like, okay, how's your sleep pattern? How do you feel? How's it affecting you? Because some people do really well on lower dose melatonins, but I think there is the risk of feeling more groggy in the morning and also upsetting your natural sleep rhythm. And that's very key as well. And I kind of, glad you brought that up, and kind of a transitional piece is that I think the difficulty comes with the medications is because they're sedating and they're affecting your natural sleep rhythm. So when you do stop taking them, your sleep rhythm's off and it's dependent on these medications. So now you can't sleep without them. And I think that's where the peptides come in, is resetting those rhythms, getting you back into that pattern of your light sleep, REM sleep, non-REM sleep. We'll talk about that more in part 2. I think that's where the benefit comes in. But again, there's so many things we can do naturally. We talk about valerian and lemon balm, and it goes on and on, kava, which I'm not the biggest fan of because, the long-term effects of that. There's so many options we have out there naturally, and the combination products as well. It depends on what's going on with the person. So I think you're hitting the nail right on the head. It's just like, it's so individual, and finding that right combination for that person and why they're having the sleep deficiency is going to be what's key to their success.
Yeah, absolutely. Yeah, and I like to use especially for that kind of busy cortisol mind, things that suppress cortisol at night. So ashwagandha, phosphatidylserine, is really amazing for the brain. So those sorts of things could be helpful once we've kind of corrected the other pieces that we mentioned earlier. CBD, I actually really like CBD for myself. I think you have to dose it pretty high for pain, but just for kind of that busy mind at night, I take a 15 milligram dose. And for some people that's helpful. Some people, if there's deeper issues, that doesn't really move the needle at all, but that could be helpful. There's, things like 5-HTP, and that's totally dependent on the person. Some people respond well to that, some people don't. And then I think, pillar one is making sure that we're getting you to sleep and your hormones are balanced and you're in this kind of state conducive to sleep. And then I think the optimization part of sleep, which we'll really dive into with the peptides, but even there's supplements that I take at night that really amplify that repair, as well as the peptides. I take this Qualia Sleep, which has a lot of these kind of anti-inflammatory blends. A lot of cellular repair is happening at night. And so there's ways that we can even improve upon what's happening at night with that repair process, in addition to just giving ourselves things to get to sleep, right? So that's kind of the fun part of optimization, which is really the peptide space too.
Yeah. And the other thing I like to think about as well, because we talked about this in the very beginning, is that there's a difficulty falling asleep and then there's staying asleep. Now, I don't know about your practice, but I tend to see a lot of people who they're like, doc, I have no problem falling asleep. I'm all good there. It's staying asleep. And so I think that is where the peptides kind of give an advantage in many cases, not all cases, but there's an advantage there, but it's just the staying asleep, getting to the right levels of sleep, getting to that restorative part of sleep. And I want to talk about that more in part two. We talk about why it's important to optimize your sleep, and then transitioning into what are some of the more cellular medicine methods we have to improve sleep. So that's going to be all in part two. I'm super excited about it. We're going to wrap this up. But before we go, Dr. Amber, please tell us how to find you.
Oh, yeah. So listeners can find me in a couple of places. Instagram is probably the best way to connect with me, either on peptides or a lot of my posts about hormones and women's health. So that's Doctor spelled out, DOCTOR, Amber, ND. And same thing on Facebook, on Twitter, and then they can find me on YouTube. So I'm doing a lot more on my YouTube channel as far as creating videos and sharing about peptides and therapies, things that I'm doing, my blood glucose monitor, all these kind of hacks that I'm using for myself and that I'm seeing helpful. So that's the Peptide Doc on YouTube.
Sounds good. Awesome. Well, thanks everyone for listening to part one. Be on the lookout for part two, where we talk more about the peptides that help with sleep and restoring sleep function, and why this is important for anyone trying to optimize their health, whether it be performance or brain function. We'll talk all about that in part two. We'll see you soon.